because this is the best height for me. So we're going to start with with an inferior glide to help improve the rotation that our patient was limited in. Jacob, you're just going to tell me if anything hurts or if anything feels uncomfortable when I do these mobilizations, okay?
Okay.
Okay. I'm going to start with an inferior glide to help improve the rotation. I have to modify the position for him because his hamstrings is very tight, so I have to sit and put his leg over my shoulder. Okay. I'm going to grab down here. Sorry about that. Get nice and close. And I'm going to do a grade 3 mobilization on him. So first of all, I'm going to check the range. You okay?
Mm-hmm.
So I'm going to do a grade 3. It's going to be a large amplitude well into the range. Okay?
Yes.
Still feel okay? All right. So we're going to do a lateral glide now for general increased mobility and to decrease pain. This leg is a little heavy for me, so I kind of rest it here to get started. Again, my hands are going to be down in here. That's the lateral mobility. Okay. I'm going to do a grade 4. We take him to the end of range and then small amplitude at the end of range. Feel okay?
Yep.
Okay. Now our patient had limited hip extension and abduction. So I'm just going to do hip extension, abduction. Grab their leg here and just going to do kind of lean back and do a grade 3, moving him into more abduction as we go. Feel okay?
Yep.
Okay. Yes. Now we're going to move to the knee, and our patient had limited knee flexion. I'm going to put his leg up on the pillow, and we're going to do a anterior-posterior glide to improve his knee flexion. So we're going to make sure his hip and knee is in neutral position. My hands are going to come here. I'm going to assess the range of motion that he has. And our patient was fairly limited, so I'm going to take down to the end and do a grade 4 at the end of range, small amplitude. What jumped?
Hmm?
Your muscles jumped.
Jumped.
Okay. Okay. Good. Feel okay?
Yep.
All right. The other thing I chose to do was patella glide. Our patient had limitations in inferior and medial glide. So making sure the leg's in the neutral position. I'm going to do inferior glide on him. So Seth, he prefers the fingers as opposed to this. And he just said it felt better and more comfortable on him, so I'm going to use the fingers. So that's the inferior glide. And I'll do a grade 4 here. Get him at the end and just small amplitude. You can also do a medial glide. Okay. Okay, can you roll over for me? Does that feel okay?
Yep.
All right. So now to increase hip flexion, we will do an anterior glide to his hip joint. Just let me have your hip. Okay. We're going to assess the motion. Okay, and I'll start with a grade 3, so large amplitude. Okay, feeling okay? Okay. Quite a bit of limitation and pain up at the ankle. So we're going to start out with plantar flexion. All right. And we're just going to do some grade 2 of plantar flexion because our patient has so much pain. So just very large amplitude at the beginning of range. The posterior anterior glide. Okay. Dorsiflexion was also an issue and painful. So we will do a anterior posterior glide, and we're just going to do a grade 1 because the patient was so painful. So just barely thinking about it, just barely starting right at the beginning of range, small amplitude, just starting it. Feeling okay? Okay. The other issue our patient had was pronation. So we'll work on that, and it was painful as well, so we'll just start with a grade 2 there. So larger amplitude at the beginning of range, trying to move into pronation. Good. You okay?
Yep.
Make sure we got everything laying on your tummy. Yep. Last one. Can you go ahead and sit up for me? Have to come in. We're just going to do some patellar glides with his knee in flexion. Put his leg over mine, and we're just going to do a 1 because I need to do another one. But just he could, because there was lack of motion, we could have done a grade 3 or 4 to gain range, but I needed to do another mobilization of 1, so we're just going to do a 1. So get his knee in flexion, hold here, and again I'm going to use my fingers just because that seems to be what's more comfortable to him. And we'll just do a grade 1 just for pain reduction. Just barely moving it. And for our patient though, I would have done a grade 3 or 4 just because they were limited. So just to show that, just really grade 3, really giving him a larger amplitude, moving that. And you can move the knee in flexion from different points of flexion to get different mobilizations of that knee at different points. Okay? All right. That's it.